Now, the one that's going to shock everyone is sickle cell.
So when you see a couple or patient for fertility,
Correct.
you routinely order these tests that test for several hundred
We
genetic things.
routinely counsel them
Okay.
and I provide the information and I tell them these are the recommendations from the American College of
Okay.
OBGYN that, screening is recommended, but I don't make it a do or die,
Mm,
right? I insist that you get the counseling and you as an adult, you have the right to make your own decision.
hmm
But the question is, have you been given all the right information to make the appropriate decision, right?
Uh,
I mean, go ahead.
yeah. And of those tests that's being tested for, just give us examples of which is the ones that would have the highest impact or the biggest
Yeah, yeah.
repercussions for a couple.
Oh, absolutely. For instance, we talked about cystic
Yeah.
fibrosis, right?
Yeah.
It's an autosomal recessive, meaning that if you have two of the defective genes, you have it. If you have just one, you're in the clear. Well, we're finding out that you may be in the clear for the lung manifestations, but if you are a carrier, it can still show up in bad ways. Now, the one that's going to shock everyone is sickle cell. And people were counseled about that. And they said, well, if you're AS, if you're, sickle trait, you're okay. Not so fast. Because some of the people who have sickle cell trait may actually have renal necrosis and they may be subject to sudden collapse during exercising. Very subtle changes from you're affected to you're not affected to you may not be affected, but there's a nuance there. And here's the things you need to watch out for so you don't fall victim to some of these things.